Good evening. My name is Tori Boderick. For my public health class, I will be discussing a policy on excessive drinking. Excessive alcohol consumption is a major problem that is affecting many states around the world and has affected both male and females of all ages, including teenagers. Beyond the chronic health conditions brought on by excessive drinking, the community is affected by an increase of resilient crime, accidents, and other risky behaviors. The excessive drinking amongst men and women has been a huge problem in the U.S. and has cost the country lots of money for treatment and medical care. The health facilities also use lots of money in treating alcohol related diseases as well as offering post addiction services to the victims of excessive drinking. The government commits a lot of resources in dealing with the aftermath of excessive drinking. According to the CDC, excessive alcohol use led to approximately 88,000 deaths and 2.5 million years of a potential life lost each year in the United States from 2006 through 2010, shortening the lives of those who died by an average of 30 years. Therefore, it is important to deal with the issue of excessive drinking as a national concern in a bid to improve the quality of public care as well as protect the next generation. The new policy aims to deal with the excessive drinking problem by reducing the number of drinking hours and also reducing the amount of alcohol that one person can drink in one setting. The new policy targets young drinkers under 25 and underage, women who are pregnant and consume alcohol, liquor shops, and nightclubs. The policy intends to restrict the alcohol sellers from selling alcohol to someone who is already under the influence, to someone who has consumed more than the recommended amount, and also to people who are below the recommended age. Public owners and liquor shop owners would be required to comply with the requirements of the policy. Failure to comply will result in a fine that is paid to an alcohol rehab center and or suspension of revoked or revocation of their license. Another group that will be affected by the policy are young drinkers who will not be allowed to take more than 2 units of alcohol. The policy also targets to reduce the drinking times on weekdays to allow for people to work and also promote healthy and productive nation. Some of the important aims of the policy are to see a change in the behavior of the people so they can agree and think it is unacceptable to drink excessively as it could cause harm to themselves and the people around them. The policy also aims to reduce the amount of violence, gun and domestic, that is impaired by alcohol consumption as well as a reduction in the number of individuals drinking above the lower risk levels given by the same policy. Another objective of the policy is to reduce the number of people from binge drinking and the number of deaths resulting from alcohol. Finally, the policy aims to protect unborn children from birth defects that are caused due to drinking while pregnant. Implementing the policy will have various cost impacts, but it is also expected to benefit the country in different ways. The policy will require the Minister of Health to set various committees which will be charged with the responsibility of ensuring that every institution dealing with the sales of alcohol complies with its requirements. The members of these committees will ensure that liquor stores and nightclubs, which are permitted to sell alcohol, renew their license and meet all of the new requirements. In order to implement the policy, there would be expenses that may be required to cover the costs to pay the members of the committee for the development and implementation of the policies. On the business point of view, the policy is expected to affect the alcohol business by regulating the sales of alcohol, and hence there might be a reduction in profits from the industry. The alcohol dealers would also be expected to spend more money and commit more resources to be able to comply with the new requirements as directed by the law. The latter is expected to increase the cost of operation for club, bar, and wine and spirit shops. However, apart from the cost of implementing the policy, it comes with various benefits that aim at improving the lives of people in the country and also improve the quality of health delivery. Reports show that the government, through the Ministry of Health, spends millions of dollars annually treating people with alcohol-related diseases and also equipping the hospitals with facilities that can handle these diseases. Implementing the alcohol policy will reduce the problem of excessive drinking and hence reduce the number of alcohol-related illnesses among the people. As a result, the country can concentrate more on dealing with other serious diseases such as cancer, HIV/AIDS, among others, which also pose a variety of challenges to the lives of the people. The money dedicated to dealing with alcohol addicts and creating facilities to handle people with excessive drinking habits can now be directed to other projects which will be beneficial to the country and the people as a whole. Implementing the policy would also help in improving the lives of youth as well as adults, as it aims at making people take responsibility for their drinking addiction. Unlike other policies, which often address the issue of excessive drinking at an individual level without considering the source, the proposed policy tackles the issue right from the source, which is the alcohol sellers. The policy aims to ensure that the alcohol dealers in the market do not take advantage of the addiction of various people so that they can sell as much alcohol to them without considering the effects of such actions. However, the policy is expected to face opposition from various legislators based on various issues. First, the amount of money and resources required to implement the policy may divide the House into two groups. And secondly, conflict of interest could also be another obstacle to implementing the policy. Some legislators may oppose the policy on the ground that it would be too expensive for the country to achieve due to money required to employ and maintain the works of the committee members who will ensure that the requirements of the policy are met. Some legislators own alcohol shops, bars, and clubs, and they are also the shareholders in companies which produce alcohol, or they are friends with people who are in the liquor business in the country. The latter might result in a conflict of interest since the policy may affect the operations of the alcohol industry in various ways, which might result in an increase of cost of operations as well as reduction in the overall profits. Therefore, some legislators might oppose the policy to protect their interests. However, the policy can be sold to other constituents by mentioning its benefits regarding how it is expected to build underage drinking, young adults, and women who drink while pregnant. This policy can help to save a life and or prevent an accident from happening by reducing the number of alcohol-related illnesses and deaths. Thank you.